What are some of the risks and complications that occur as a result of spinal surgery?
The biggest risk that patients really face with a spine surgery nowadays is not getting better. That's the largest statistic, and that's the one we fail to tell them about. In other words, they could have a scar, have a hospital bill, and not be any better. And it depends on the problem and the procedure. It could be anywhere from 10 to 15% that they might not get better. The complications that patients really worry about, being paralyzed, infection, spinal fluid leak, all those kind of things, are not as common as people think. Nerve injury or spinal cord injury with spine surgery does occur. It's not unheard of, but it's not really that common. And particularly nowadays with techniques and procedures and even spinal cord monitoring systems, I think that's even less than it used to be in the past. That seems to be my experience. Infections, when you talk about infection rates, some surgeries have a higher risk of infection than others, but across the board, you would probably run nationwide about 3% to 4% risk of infection, and that's probably a high number. Ours last year was 1.4%. I'm not sure what it is this year yet. The data is still not back. Spinal fluid leak is probably the most common complication that occurs intraoperatively in spine surgery. And patients might not even know it, not because we're trying to hide that from them, but because we fix it and it's not a big deal. And having a spinal fluid leak, or a dural tear is what it's called also, the tear sort of makes it sound like it's careless, and it's not, it just happens. Don't seem to affect the outcomes. But on occasion, some person may have a small dural tear that we can't see with a microscope, or doesn't even leak spinal fluid during the surgery, and we close them only to find out that it's leaking and we have to take them back later and repair it. That's not real common either, but it does occur. It's more common in redo spine surgery. It's more common in people who have had a previous spine surgery and are having another. And that's also true for the nerve problems and the infection rate. Repeat spine surgery has a little bit higher complication rate, but it's not double the rate. So those are the typical ones that we talk about. But when you add all those up together, that number is still much less than just not getting better.